Hello friends, I am Dr. Praveen Sadarmin, consultant interventional cardiologist at Narayana Health, Sandra, Bangalore. Today we will talk about various cardiac tests and procedures and what do they mean in general. So the first thing that anyone who comes to see me or all of us do is a routine blood test. Routine blood tests include a CBC, which is like looking at your hemoglobin, platelet count, sugars, HbA1c, what we call the 3-monthly average sugars, cholesterol levels, and we also look at the kidney function test. So these are very basic tests. After that, we want to do an ECG. ECG, as you can see, it's a pink paper with lots of wiggly lines coming on it. So it does give us a lot of information of how is the heart functioning, is there been any previous heart attacks, or is there any changes, potential for looking for blockages in the heart. This is not 100% foolproof, and the ECGs can be completely normal even when there is a blockage. The next test we would probably want to do would be an echocardiogram. Echocardiogram, as you all know, it's an ultrasound scan of the heart. So whatever we do as the ultrasound, for the heart it is called as echocardiogram. It does give us a lot of information here also. We look at the pumping function of the heart. How is the heart pumping? Because heart is basically a pump. So we want to know how is it functioning. Is it able to pump the blood to all parts of the body? How are the valves? Because there are different valves. Valves are like gateways. So they open and close. When they open, the blood flows from one chamber to other chamber. When they are closed, no blood should be flowing. Is there any leak back into the chamber that has already sent the blood? Is there any blockage of the valves? Are they opening or closing properly? So these are some of the information that we can get. And then there are also other information which is more technical, but this is some of the basic things. We also look at the function, the pumping of the heart, whether part of the heart is not functioning properly. Because when there is heart attack, part of the heart can be damaged. Sometimes even with what we call a condition called cardiomyopathy, where the heart becomes weaker, the whole part, the global, the whole heart will function less than what it should do. So these are information that we get from an echocardiogram. The next step, sometimes if we are suspecting blockage, would we do a CT coronary angiography. This is a test which has become very, very common these days. It is very simple to do. Within 5 minutes, you go inside the scanner, you come out. A lot of information on the blockages of the heart is available from this test. There are 3 main coronary arteries, 2 on the left and 1 on the right. So we look at how the blood is flowing through these arteries. Are there any blockages that we need to worry about? Blockages do happen in almost all patients. See, what we know is from the age of 20 plus, cholesterol start building inside the arteries, but the body has got a mechanism to clean these as well. So it's a continuous process. When there is an imbalance, it starts to accumulate more, and in particularly as age progresses, we tend to see more and more blockages. However, this depends on multiple risk factors. High cholesterol, diabetes, high blood pressure, stress, smoking. So a lot of factors are involved, but to assess the degree of blockages, we look at the CT coronary angiography. If there is any major blockage, then we would want to do a conventional coronary angiography. This is as an inpatient. So the patient is admitted usually in the morning and then can be discharged by late evening or next day. We put a small plastic tube that goes all the way into the heart. Usually it's done through the wrist, which is much more comfortable compared to the groin. And then we inject a dye, and then we look by the X-ray how are the blockages. So if there is nothing serious, we're going to go with medical management. If there is any blockages, then we can either advise coronary artery bypass grafting or a stenting procedure. So it all depends on the individual patient, but this is in brief of what we do. Thank you.